The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
Hello and welcome to this special edition of the American Health Journal. I'm Roger Cooper. For this half hour, we travel to Laguna Hills, California to speak to the physicians of Harvard Eye Associates. We'll talk about a very common condition called dry eye syndrome. It can cause mild to severe ocular discomfort, and it can result in blurred vision. We have some very interesting insights to share with you. As we learn more about dry eye, the physicians were clear to point out
dry eye is much more than a simple problem. Dry eye causes serious disability. Studies have shown that people who have moderate dry eye are impaired from doing things just as much as people with heart failure.
The doctors also told us about the causes of dry eye.
If you live in a very dry climate or if you live at a very high elevation, you're quite likely to have dry eyes.
Other causes for dry eye sometimes have to do with disease.
There are other causes for dry eye, and some of them have to do with eyelashes and crusting that is on the eyelashes, a condition that we call blepharitis.
In some cases, treatment for dry eyes can be as simple as using artificial tears.
For many people who use artificial tears, that takes care of the problem that they have. For people who have more severe dry eye, then they certainly need to have more treatment.
Then, if dry eyes can't be alleviated just by using artificial tears,
since a lot of the dry eyes can be attributed to inflammation, steroids are naturally helpful in decreasing the amount of inflammation that is present.
A common question often asked of the doctors is how can nutritional approaches remedy dry eye?
Well, we're often asked if there are any nutritional supplements that can help dry eyes. The short answer to that is yes, there are.
New advancements in surgical approaches have proven fairly effective.
When simple treatments for dry eye fail, like nutritional approaches, supplementing the tears, using warm compresses, and so on, we have to do something more. And we have a variety of surgical approaches to dry eye that are fairly effective now.
All next on the American Health Journal. We'll begin our program by learning more about the causes and symptoms of dry eyes with Dr. Roger Ohanessian and Dr. Diana Kirsten.
Dry eye is really a compilation of several different diseases. Because the tear is composed of three layers, the oil layer, an overlying oil layer, a water layer, and a mucus layer, it can be one of those components that can be inadequate and would make the eye dry. If it is that the water component is reduced, then the eye has less water and therefore less irrigation onto the surface of the eye. As the eyelid comes together and pulls apart, it's like a squeegee, so that the eyelid goes down, picks up a little water, goes back up, and if it goes back up dry, then it's like a dry squeegee, and it causes irritation to the surface of the eye. Also, the oil layer protects the water layer from evaporation. If it's inadequate, then the water is exposed and evaporates very rapidly. That presents itself as a dry eye condition. The patients have to rapidly blink to be able to see more clearly and also feel and not have the dryness. Lastly, the mucus layer. Well, the mucus layer is the bottom layer closest to the eye itself. And that layer allows the water to spread. And so the result is that the tear film is inadequate, allowing the eye to feel itchy, burning, scratchy, and irritated.
Dr. Kirsten says there are many symptoms to dry eyes.
There's so many symptoms that people have when they have dry eyes, and naturally a common one is just that their eyes feel dry, but they can also get painful eyes. Some people come in and say their eyes are red or blurry or painful at the end of the day, burning sensation, an itchy sensation, fatigue, eye fatigue.
Usually patients who suffer from dry eye will experience dry spots on their eyes, as Dr. Kirsten describes.
What happens often with dry eyes is that your eyes get so dry that you develop little dry spots on your cornea, like little scratches. And then the reflex mechanism kicks in and your eyes tear and tear and tear, trying to re-wet the eyes. Unfortunately, that doesn't work very well because that kind of tear is very aqueous and doesn't help the problem very much. But many dry eye patients actually come in with a complaint of tearing. I do think how much someone sleeps at night can be causative for dry eyes. At night when you get tired and your eyes feel heavy, that's often a feeling of dryness that's giving you that heavy feeling. Your eyes tend to re-nourish themselves at night, and a lack of sleep is certainly a causative factor, as is staring at a computer screen all day. When we stare at something all day, we tend to not blink as much and our eyes get very dry. Usually we're in an office where the air conditioner's on and the humidity's drier.
And Dr. Kirsten says where you live can be another element contributing to dry eyes.
If you live in a very dry climate or if you live at a very high elevation, you're quite likely to have dry eyes. If you're a flight attendant or a pilot and you're in an airplane a lot, the humidity is very, very low in planes and you're more likely to have dry eyes. People who have certain diseases like rheumatoid arthritis, thyroid disease, they tend to get dry eyes more. Certain medications will dry out your eyes. If you've had LASIK, if you've had eyelid surgeries, that can cause dry eyes. But certainly our most common patient, I would say, is a woman who's over 45 years old.
When we come back, a report from our Laura Windsor. It's on a disease not commonly known, but your chances of getting it increase with age.
You're watching the award-winning American Health Journal.
Now, more on the causes for dry eye. Here's our reporter, Laura Windsor.
Blepharitis is a disease that Dr. Roger Owenessian describes as another contributing factor to dry eye.
There are other causes for dry eye, and they are particulate matter. Obviously, if you go through a sandstorm, you'll have particles within your eyes. They'll become irritated. The same thing is true if you have different diseases. And some of them have to do with eyelashes and crusting that is on the eyelashes, a condition that we call blepharitis. Demodex, which is a mite, a very small little creature, parasite. It's the most common age-dependent parasite that's located within the skin. It's also a very hard organism to eradicate. Demodex is probably the most common but overlooked disease causing ocular surface degeneration and inflammation.
Dr. Owenessian says that this disease is associated with certain skin conditions.
Demodex has been implicated in rosacea, is where there's a redness to the skin, the surface of the skin, and as well the pustular folliculitis is one where the follicles within your skin become infected. They also can develop a surface skin changes that can lead to basal cell carcinoma. In Demodex blepharitis, there is crusting along the margin of the eyelid. These crusts form on the eyelashes. It makes the eyelash look as if it's got a turtleneck. We call it cylindrical deposits. And these deposits are really one of the signs of this Demodex. They're really the waste product, the feces, that the organism produces in a spiral fashion that forms around the eyelash. They're really arachnids, eight-legged creatures, and they have two of their legs have been converted into mouth parts. But they eat the oils. They live with us almost symbiotically, but when they get into very large numbers, that's when a problem is caused.
This diagram illustrates the life cycle of the parasite.
They mate on your eyelids at night. So every night they come out, mate on your eyelids, and then go back into the follicle, sometimes taking staphylococcus, a bacteria, back into the follicle with them that can create other diseases. The most amazing thing about this is the high number of these organisms that exist in all of us. It is age-dependent, but within the first few years of life, we're able to find these disorders.
Dr. Owenessian provides statistics on the probability of getting this disease.
The numbers increase with age, so that by the age of 50, 66%, two-thirds of the population has this disease. It just continues on until it's nearly 100% by the age of 90. They're found often in our hair follicles and migrate down to the eyes. They're very common in the eyebrows. So it's one of those disease processes that is out there in the population and as well in our air and difficult to avoid.
The disease itself causes more than just the localized inflammation. There can be further disease processes.
This is meibomian gland manifestations of the disease. You can often see is that in the photograph you can see where the glands themselves became infested with this. It'll also cause chalasia to form. It'll often cause eyelashes to become deformed and turn into the eyes, and sometimes even losses of lashes. The disease itself is very prominent and very frequently found among people who have eyelash loss.
The common question most asked of Dr. Ohanessian is how to get rid of Demodex.
It is resistant to most conventional treatments. Baby shampoo doesn't get rid of it. 75% alcohol doesn't get rid of it. Erythromycin or any of the other antibiotics don't get rid of it. But tea tree oil will kill off these organisms. Tea tree oil is a substance that is produced and is presently something that requires a physician's prescription, but is rapidly going to go to be an over-the-counter product. What is necessary is for, of course, the initial identification of the disease and then by your physician, and then the physician would be able to write a prescription for you for the medication.
Using tea tree oil has proven highly successful in eradicating these organisms and eliminating the disease for patients with dry eye. For the American Health Journal, I'm Laura Windsor.
When we come back, more simple treatments for dry eye from the physicians of Harvard Eye Associates. Simple treatments for dry eyes can range from artificial tears to an alternative treatment where punctal plugs are used. Dr. Karen Scarvana tells us about the simplest treatment, which is commonly recommended first.
Artificial tears are usually the first line of defense when it comes to dry eyes. That is something that will be most commonly prescribed when you go in to have that checked out, or when you have dry eye symptoms checked out. You would be told to use those tears about 3 to 4 times a day. If those tears are not helping, then we would go to something like a gel drop. We would add the gel drop, or we would just have you use the gel drop in the morning and in the evening. For a person who has more severe dry eye, we often will add that lubricating ointment or gel at bedtime. One of the simplest ways of treating dry eye is to use wraparound glasses. They keep the moisture on the eye, prevent evaporation of the tears from the eye, and they can prevent allergen and dust from getting onto the eye. It's very important to go in and ask your eye doctor what tears he or she would recommend for you. For many people who use artificial tears, that takes care of the problem that they have. For people who have more severe dry eye, then they certainly need to have more treatment.
Dr. John Ohanessian told us how dry eye affects our vision.
One of the most common problems for our patients is that they have dry eye, they've been given artificial tears, they've used the lubricant drops from the drugstore, and they still feel uncomfortable. Their eyes are still red. And the problem is they're not fully treating the problem. They're replacing the water in their tears that's deficient, but they're not replacing the oils that are deficient. Tears are much more complicated than just simply water on the surface of the eye. There's a complex chemistry that's made up of oils and water and salts and mucus and proteins and a bunch of microchemicals that make a huge difference in giving us clear vision. When dry eye is significant, it really blurs vision for people. That's because the surface of the eye is meant to be covered with a glassy, smooth layer of water and other elements. And it's like a swimming pool. When no one's been in it and the water is glassy smooth, you can see everything perfectly in the bottom of the pool. When someone puts just a toe in the water, your view goes completely. And this is what happens to people with dry eye. One of the more common problems that makes artificial tears fail is a deficiency of the oil in the tears. And that's because it's very hard to put oil in a bottle that will work and can be supplemented on the tears on the surface of the eye. We want best to produce more of our own oils. And a simple way to do that is to use a warm washcloth. Just simple warm water, not hot, on a washcloth placed on the surface of the eye with gentle pressure on the eyelids will stimulate those oil glands to flow a little bit more. It provides almost instantaneous comfort, and it also improves the flow of the oils.
It's easy for doctors to miss the symptoms of dry eyes, so new technology for diagnosis is being used.
A new system called LipiView is designed to help us to understand who has a deficiency in these oils in their tears. It uses laser light. It's a simple exam that takes just a few seconds in the office, but it scans the surface of the eye to determine how much oil is present. When the oils are deficient, it clues us into the presence of this problem that is treated in an entirely different way from simple dry eye.
Once a diagnosis is made for dry eyes, Dr. Diana Kirsten recommends another alternative treatment.
One of the treatments for dry eye is punctal plugs, and usually we try eye drops and other things first, so this is a secondary treatment. And it's a treatment that works very, very well in most cases. I'm a big fan of it, but it's more successful in my hands, I think, than most other things. And what we do is we place a little soft plastic plug into the tear drainage duct. And the tear drainage duct has an upper and a lower punctum or opening, so we generally just plug the lower punctum. And this prevents your tears from draining off the surface of your eye as quickly. So your own tears stay on your eye longer, and this increases the lubrication and the healthy tears that stay on your eye. It's a very easy procedure. We do it right in the office. Generally, the plugs last for years. They've been updated. There's about 6 companies that make plugs now, so they come in different sizes, different shapes, different materials. And I found this to be a very effective way to treat dry eyes.
When the American Health Journal comes back, more on dry eyes.
This is Dr. Ray from Dr. 90210, and you are very smart because you're watching the American Health Journal.
And now back to Roger Cooper and the American Health Journal.
When simple treatments don't prove effective for dry eyes, Dr. Paul Park says that certain prescription medications can be used for more severe conditions.
Dry eye can be treated with many medications. One such medication is Restasis. It's an anti-inflammatory medication. It's in its strong dose, it's used for organ transplants to keep the body from rejecting organs. But it is a very dilute concentration that's used for inflammatory dry eyes. The idea being that anti-inflammatory drop will decrease the inflammation in the lacrimal gland, which is the gland that's responsible for tear production. And this will increase tear production and thus cause improvement of dry eye symptoms. Another medication that can be used is various types of antibiotics, such as erythromycin. One of the properties of the antibiotic erythromycin is that it stabilizes the lipid tear layer. So it helps to keep the tear longer on the eyeball, thereby ameliorating your condition of dryness. In addition, it has antibacterial property, which can cause inflammation along the eyelids, which can further deteriorate your dry eye symptoms.
Another treatment option, Dr. Park tells us, is effective.
Steroid eye drops are natural anti-inflammatory medications. Therefore, since a lot of the dry eyes can be attributed to inflammation, steroids are naturally helpful in decreasing the amount of inflammation that is present in the meibomian glands, which are responsible for tear production as well.
Dr. Park tells us it all depends on the type of dry eyes you have.
Well, if your lacrimal glands are not producing enough tears, then using a steroid on that is not going to be that helpful. Therefore, you use Restasis on someone with people with inflammation in the lacrimal gland. However, people with meibomian gland dysfunction or inflammation caused by bacteria are treated with specific modalities for those kind of conditions, such as antibiotics and steroids.
Dr. Park says these medications are successful, although the results don't come immediately.
They are very successful. The newest of the 3 modalities is Restasis, and unfortunate thing about Restasis is that it usually takes about 3 to 4 months of use before you actually realize the benefit of that medication. However, steroids and antibiotics, most people feel symptomatic relief within a couple weeks.
When we return, how nutritional supplements could alleviate symptoms of dry eyes.
You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch the American Health Journal each week on this PBS station.
Dr. Edward Kim tells us there are nutritional supplements that can benefit dry eye.
We do have nutritional supplements that are available that reduce inflammation to the oil glands. If we can reduce the inflammation, those oils become more natural, and therefore we prevent evaporation, and when we can prevent evaporation, we have less symptoms of dry eye. That supplement is called omega-3 oils. These omega-3 oils are called essential fatty acids because although we don't produce them, we have to get them through foods. They're essential for human nutrition. Omega-3s help reduce inflammation, and so they can play a role in reducing heart disease, arthritis, and even lowering triglyceride levels. They need to be in good ratio with another omega oil, which is an omega-6 oil. So omega-3s and omega-6s need to be in proper ratios. A good ratio would be a 1-to-1 or a 1-to-4 ratio. An American diet, however, can have a ratio of about 1-to-30 because the omega-6s are found a lot in meats, and the meats contain a lot of omega-6s. Omega-6s can be pro-inflammatory, meaning they can cause inflammation. In contrast, if you have a Mediterranean diet rich in fish, olive oil, fruits, and nuts and vegetables, you have a much better ratio, and we think that that is helpful in reducing inflammation. Omega-3 oils are found primarily in fish, cold water fish, like salmon, tuna, mackerel, sardines, but it can also be found in plant material, such as flaxseed or nuts, soybeans. But you can purchase them as a supplement, or you can have them as a food source. But of course, if you can eat them as a food source, that's even better.
Dr. Kim tells us taking the proper amount of omega-3 supplement will give you optimum effectiveness.
The amount of omega-3s that people can take range from anywhere from 1 gram to 3 grams per day. But as you approach 3 grams a day, we must be a little bit careful because patients in particular, those who are taking anticoagulants such as aspirin, Coumadin, Plavix, this omega-3 can help increase the likelihood of bleeding. So please consult your doctor. The other point is that omega-3s can sometimes raise your fasting blood sugar. So again, talk to your doctor about that. When you take omega-3s, and in particular you take fish oil omega-3s, it's really important to look at the product and make sure that they've addressed an issue that's very important, and that is contaminants. Because when they process the fish oil, they can concentrate heavy metals such as mercury. So make sure that the product you're looking at addresses this issue.
When we come back, the latest in technological improvements to treat dry eyes. After dry eye patients have thoroughly exhausted all recommended treatments, Dr. John Hovanesian offers a surgical approach, one that's proven effective in the treatment of dry eye.
When simple treatments for dry eye fail, like nutritional approaches, supplementing the tears, using warm compresses, and so on, we have to do something more. And we have a variety of surgical approaches to dry eye that are fairly effective now. Probing the glands that are deficient in oil is one approach. Meibomian gland disease is a common problem that's present in as much as 70% of people who have dry eye. And the meibomian glands, which produce the oily portion of the tears, are deficient. They produce a very thick, sludge-like material instead of a thin vegetable oil-like oil that is meant to coat the surface of the tears. When the oil glands are deficient, all the symptoms of dry eye are much more pronounced. One approach is to open those meibomian glands mechanically, to use a probe through a microscope. The surgeon will probe the glands to open the blockages that are preventing the oils from coming out, and this can be fairly effective.
And another approach that's used is to treat the oil deficiency by applying heat right where it's needed.
Another approach is to use intense pulse light, or IPL. The approach with intense pulse light largely depends upon heat that the light produces. The traditional approach to treating meibomian gland disease, oil deficiency, is to apply heat to the eyelids. Doctors recommend warm compresses, and these really do feel comfortable. But the problem is that they don't last long enough in their benefit of providing comfort, and warm compresses simply don't get the heat where it's most needed, and that's on the inside of the eyelid where the glands are. A new approach is to use a system called LipiFlow, which applies heat from the inside of the eyelid directly on the glands, which are not flowing, the meibomian glands, and also a little bit of pressure on the outside of the eyelid in order to cause those glands to be squeezed and to flow. It's a comfortable procedure that takes about 10 minutes. It's done in a doctor's office, and the effects of using this have been shown in clinical studies, in many cases to last for many, many months. We're looking for a treatment for dry eye that lasts more than a few minutes, like an eye drop. We're looking for a solution that allows people to return to a normal life. And we hope that LipiFlow for people with evaporative dry eye, which is meibomian gland disease, will provide that relief.
Thanks for watching this special edition of the American Health Journal. We'd like to recognize the physicians of Harvard Eye Associates in Laguna Hills for their participation in this program. If you'd like more information on the topics you've seen in this broadcast, please call us at 1-800-303-3200. I'm Roger Cooper for the American Health Journal.